Hello, everybody, and welcome to Functional Medicine with me, Dr. Howard Robbins. Our show is dedicated to helping you in natural, safe, and effective ways, treating diseases and conditions that will affect your life either by killing you or, which I don't mean to make light of, or make you wish you were dead. One of them, and the one we're going to talk about today, is acne. About 85% of the people, it's estimated in, at least here in the USA, probably worldwide, will develop acne at one point in their life. While it's often thought of as a disease or a condition that affects only teenagers, that's not true at all. You can get it at any time and any age. And there's various forms of it. Basically, your skin, and we're going to get right into things. So you may want to make notes. You may want to get a pen and paper to make notes on these things. I think that's a wise move. Um, while many of my shows just go into how to treat it, I've been getting emails from people who want to know more about it and don't want to do their homework themselves. So I'm just going to give you, probably in some future shows, more information about the disease or condition. It's not to help you diagnose it, whichever the disease or condition it is, but certainly it's informative and people want to hear that, apparently. Well, everybody, we all have our skin, and our skin has, hair follicles, and it has that can produce, as well as just the skin itself to stay soft and supple, produces an oil. And that's why our skin, as we lose the oil and the ability to produce these from these sebaceous glands that we have, these oil secreting glands, your skin will dry up, it starts to wrinkle and things like that. And people spend fortunes on products to try to reverse that kind of a thing. Well, when these follicles get blocked up, very simply, uh, they can get blocked up with dead skin cells, with an excess production of the sebum, of the oil that the glands are able to secrete. Um, then you can get an overgrowth of bacteria, particularly one called Cutibacterium acnes. Um, it's a Everybody's got it. It's on your skin. Generally, it doesn't cause any trouble unless it gets into, these blocked up pores, if you want to call them, follicles, and they become inflamed. And the skin around it can become inflamed. And the bacteria then can cause an infection. And that's where you start to see pimples. It's as simple as that. And they can just be simple bumps where there's no visible, pus infection of consequence, and or they can blow up into big ones. They can even become cystic-like and form nodules. They can become painful, all right, and depending on where they are. Some of them even can turn into cysts where you have lumps. And of course, when as the body tries to deal with it, it can give you some permanent scarring. And when it happens on the face, because the skin is so gentle and sensitive there, um, you can it can be disfiguring in many ways. And certainly it affects people psychologically, socially, emotionally, probably even spiritually. Terms of people looking at you and wanting to date or go out, marry you, it affects people's feelings about your appearance. And I can understand how it can become very hurtful in people's lives. I mean, I had it when I was a kid because I didn't know what I know now, and what I'm going to be telling you to do that can help not only treat it but prevent it. And that's the key to our show is treatment and prevention, but safe and effective natural ways. One of the things you want to avoid is, as you're going to learn, is antibiotics, and you'll understand why. And And I have some special takes, which is why I've been so successful in helping eliminate it, that you're going to be very interested in hearing. And there's various forms of it. You have the cosmetic form that I talked about, but there's a whole bunch of different types of adult acne. You can get acne from drug-induced cosmetics. Um, Babies can be born with it. There's a whole wide variation, and they all come with various medical terms. I don't really care because we're going to fix it all. That's what it comes down to. So it isn't necessarily just one thing that's causing it. For example, there's hormonal changes in your body that can cause it. That's why teenagers get it when they start to develop changes in their testosterone, the dihydrotestosterone, their insulin levels, cortisol levels. All these things can cause an exacerbation of this sebum to take place. One of the things that causes an exacerbation of sebum is what I believe one of the big mistakes made in the treatment of acne, and that's to use lotions or soaps that dry the skin out. Well, think about it. Your skin is overproducing oil. Now you dry the oil out. You take all that oil out. Now the skin is dry. What are you sending a message to your oil secreting glands to do? Well, we need more oil. So you want to make more oil then. And they they don't, the body is not a light switch with everything. A lot of people think yes and no, on or off. It's not that way. There's sometimes, and in various people, that's why some people don't get it and other people's do get it more or worse. Some people, their bodies don't know how to turn things off. They can um, exacerbate, they can intensify their process, and they don't just slow down. So these oil secreting glands, once you dry out the skin, may start secreting more oil, but don't know when to stop. And in fact, you're sending a signal, we need a lot more oil. And so it becomes a battle. More oil being produced, you go outside, dirt gets in and attaches to the oil that's on there. Ultimately, infections occur. And it doesn't have to be just from that normal bacteria that we have. It could be from what's in the air that attaches onto it. Um, so yeah, it's important to wash your face and hands and your body because you can get it all over your body. Um, Buttocks, very common areas to get it. The back, the chest, and that often comes. It's in the deep tissue, so can also be very disfiguring. But we're going to be talking about that. There's an inflammatory process that takes place, and our body develops what's called interleukins to deal with this, that causes this inflammatory process. And then just to be fair and reasonable, there's a genetic influence to this. I mean, not in everybody, but some people have a genetic predilection for excess oil production, or maybe they're hormonally sensitive, maybe their immune response is diminished, okay, or maybe their skin has a tendency to scar. Um, so there is some genetic component to this, but while it matters, it's more controllable than you would believe or be led to believe by traditional medicine. And diet plays can play a big role in this in people who are on the edge or who want to prevent it. Um, People that are on high sugar diets or even high glycemic index diets, that means there's a lot of um, carbs, simple carbs in their diet. People who use a lot of sweetened beverages, any kind of refined carbohydrate is pretty bad. Some people have sensitivities to milk or whey protein and things like that. So stress is one of the big causes of this. Uh, when and the whole concept of acne and how it's affecting your life socially, particularly when you're a teenager, um, is stressful. You want to go out on a date and suddenly you have a big zit on your nose, um, or on your above your lips or on in your face, and if you want to kiss your date goodnight, they're looking at this, and for some people it's upsetting and it can turn them off. Um, they're it's not a pretty sight. It can be very upsetting, and that's a big thing. But we're going to get into the natural treatments now to deal with this social disease. And one of the most important ways I'm going to get into more serious issues and methods and how to treat it. I just want to give you let's talk about the more serious treatments first, and then I'll give you all the other supplements and stuff that you can take. So first of all, the gut microbiome. It's called the gut skin axis. Go to AI, whichever AI you want, and look up gut skin axis. The gut contains about 70% of your immune system. And the gut microbiome, the probiotics that, if you have any in your gut, connect to every organ and every system in your body. I've done podcasts on it. You can listen to it in greater detail if you're interested. But the gut microbiome is essential in getting it healthy again if you want to get rid of acne. And that's why it keeps coming back. Most people have had antibiotics even once in their lifetime, or they eat red meat or chicken that isn't organic or farm-raised fish. I don't care if you burn the meat, you're going to get uncooked out doses of antibiotics eventually, particularly from takeout. I mean, when you're at home, you can buy organic, you can buy halal or kosher, where you would hope that there's no antibiotics used, at least in the animals. But I haven't eaten meat or chicken in 46 years. I stopped in 1980. So as of the date of this, it's 46 in January of 1980. So I have a set time. So I haven't had meat or chicken in, wow, 46 and a half years. And I don't need it. I get all my protein from um, legumes and vegetables and grains. And I do eat some fish. I eat eggs. I went back from being a strict organic vegan where I do eat organic eggs. I do use some dairy. So I get not milk or anything like that, but I'll eat some cheeses, hard cheeses and stuff. Organic, hope usually when I can. So bottom of it all, I get plenty of protein, but when you're a meat eater, you're going to get doses of antibiotics, whether you like it or not. So you have to replenish the healthy bacteria in your gut. Capsule, as you're going to learn if you go to some of the other shows in greater detail, I'm just going to give you the overview. Capsule, powder, and tablet probiotics are basically destroyed in the freeze drying process. Most of them are not made of what's called next generation bacterias, which means they're capable of surviving stomach acids 85 to 90% or more. Most of them are not able to do that. If they do come out of suspended animation and back to life. So, and then grow into healthy adults. The next thing is they have to stick to your gut wall, not just aid digestion. That's why eating, I take probiotics, I drink kefir, or I eat yogurt, or I eat raw sauerkraut. They're all good because they aid digestion. They naturally contain, well, they're made and contain acidophilus, sometimes a couple of other bacterias that are in what we call rod shape, like your index finger. They aid digestion, but they don't stick to the wall. You need the kind of bacterias that have fingers and toes that can grab onto something and hold on. And that's why most of them don't have that if they did come back to life, that ability to do so. Doctor's Biome, and this is something you have to go online and get. You go to doctorsbiome.com, doctorsbiome.com. And if you want to get, it's not a cheap product. It's a very highly beneficial one. Why? Because all the bacteria are living. They're all next generation bacteria. They're all GRAS, by the way. That means they're GRAS stands for generally regarded as safe, meaning it's their approved um, probiotics that are safe for human consumption, and babies and children can take it as well. Um, and they're delicious, but they're all living and growing every day in number because they're being fed with what's called prebiotics, their food, all right, which is ba- uh, basically, let's say, fiber from the vegetables that are in there. And the fiber feeds them, and that's how they grow in number. The fiber feeds them, and that's how they grow in number. And there's billions upon billions, hundreds over. By the time you get it, when they put 27 billion in to start, within couple of weeks, it's well over 50 to 60 billion. So when it's approved after safety testing at their lab, at the independent lab, uh, when they finally start shipping it out, it's already up in the 50, 60, 70 or more billion colony forming units, CFUs. They're just growing like crazy. Within a month of manufacture, they're already well over 100 to, and sometimes as much as 300 billion CFUs in there. Uh, and you drink 1 2 ounce shot a day, and it's delicious because they're all living in a 100% organic um, vegetable fruit juice. And you can look on their site, and they'll explain what the juices are, the two different types that they have in terms of juice choices, and they're all organic, 100% organic, and it comes with a 100% money back guarantee. And I'll let you use my patient coupon code, Howard35, Howard35, and you'll get 10%. It's free shipping, but you'll get 10% off the retail price. And it comes with a 100% money back guarantee. In fact, it's better than 100%. Yes. How? If for some reason you can't take it, you can't use it, you have some reason why after you've tried it, um, and you contact them, they'll give you your money back, and you don't have to send the product back. They'll tell you to give it to somebody else who might benefit from it. That's unbelievably great. So you want to go to doctorsbiome.com. You get a month's supply, 32-ounce bottles, and you put one away each day. If you don't do that, getting rid of your acne is going to be more than just a battle. I think it's a battle that it's a war you're going to lose. Okay. You may win temporarily with all these other things I'm telling you, but ultimately you're going to lose. The second thing you can do, if all the things I'm going to tell you on the show don't work, okay, by itself, is you need to do intravenous ozone therapy. The hyperbaric high dose ozone therapy, nicknamed 10 pass, that we do, or the direct IV method, which is less costly and easier because everybody can have it because it only requires little itty bitty veins. I've We've seen acne all over the body, and we've been able to eliminate it permanently, completely, once and for all. So, yeah, occasionally you might get a zit or two, but we get rid of some of the most impossible to get rid of acnes that you've ever seen. And if that's the case, you're going to need intravenous ozone therapy in the methods that we use here in our office in Manhattan. So you may be necessary to contact me. We'll give you contact information at the end of the show. But for many people, just getting the doctor's biome and doing some of the natural things that I'm going to go over with you now could be the difference between needing any other method or not. So diet, we know, plays a very important role. So you want to be on what's called a low glycemic index diet. That means it has only natural occurring sugars in it, no artificial sugars, or anything like that, and certainly no refined sugar, which is what most you know sodas and things like that have in them. Um, a Mediterranean style diet is also a good diet to be on. You want to have lots of servings of vegetables, particularly green leafy vegetables. You want foods that are rich in, and I like to stay away from the fish oils. So the omega-3 fatty acids, foods that are high in it, would be a good way to go. Um, and again, stay away from processed foods, artificially colored, flavored, and preserved foods. I think all this gets in the way. You need a certain amount of healthy sleep each night, um, because that helps increase cortisol, and it helps diminish inflammatory cytokines. You want to diminish your cortisol, I should say, by getting enough sleep, and diminish these cytokines, these interleukins, and reduce insulin resistance. And that's where regular and healthy sleep becomes necessary. Everybody needs different amounts. Because of all the way I eat, the way I exercise, the intravenous ozone that I've done, and all the rest that I do, I only sleep 4 to 5 hours a night. That's all I need. And when I was in, yeah, I'm 78, but when I was in my 30s, 40s, 50s, and even early 60s, I only needed 3.5 hours, 3 to 3.5 hours sleep. I was in the tremendous condition. I worked out 5, 6 days a week in the gym to get ready for 2 nights of judo, and survived judo. And in the end, it gave me such tremendous energy levels that I don't need a lot of sleep. I wake up automatically after now 4.5, 4.5, maximum 5 hours, and I go all day until the next day. And you can too. Believe me, all you need to do is be resting your eyes and resting your muscles and body. Your brain never shuts off, and so that's where meditation becomes it can be very important. I do transcendental meditation, TM, since 1976. And 20 minutes of TM, even once a day, can make a very big difference in your energy levels. But also, it reduces stress in your body. And with the less stress, the less chance that you'll make acne. Regular, regular aerobic exercise, 20 to 30 minutes, 3 or 4 times a week. More might be better, but you don't need heavy duty. But regular aerobic exercise can reduce stress hormones. It improves your mood. It reduces inflammation. Um, it improves your insulin sensitivity. It just does so many important things that can help with this. It's not one thing. Don't think, well, I'll do this and then try and see what happens. And if it doesn't work, you'll go to the next thing. This is a circle of care. You want to add on as many of these things as you're physically and financially capable of doing. So everybody needs to take zinc. I don't know but I believe zinc piconolate is still one of the best forms to take. 20 to 50 milligrams of zinc every day is what I recommend. And I believe zinc piconolate is still one of the better forms, though they're always testing new and better ways of doing it. You want to get omega-3 fatty acids, as I mentioned earlier. Um, Ideally, you get that from food that other than from fish oil, which is common because there's issues over getting those omega-3, 3 and 5 fatty acids. Vitamin D, very important for this. Vitamin D3, um, and of course, you need to take vitamin K2 to help absorb the vitamin D3. Um, Everybody is deficient in it. I don't care if you get into the sun like I have or not. Everybody is deficient in vitamin D. It seems like there's no way you can take enough of it. I recommend at least 10,000 IUs a day. Don't be worried about hypervitaminosis D. It ain't going to happen. First of all, you're not going to absorb everything you take orally. Everybody's digestive system is different. And even when you repair it with doctor's biome and or if intravenous ozone, um, you still will not absorb 100% of what you're taking into your blood. And then remember, every supplement you take comes in has to have certain qualities. So you don't want to buy cheap. You want to buy quality product from quality companies. It has to be bioabsorbable. That means your gut has to be healthy to absorb it and bring it into your blood. It has to be bioavailable. That means that of a form, now that it's in your blood, that your cells can uptake. And then it has to be bioutilizable. That means now that it's in the cell, it's in a form that the cell can actually do something with. People sell products to make money. We're in a free enterprise society, and they can sell you anything they like, and they can sell you cheap crap and charge you a lot for it. And that's why I say go to the big reputable companies that sell these products, and their company's reputation is very important to them, so they make sure that you're getting the best. Green tea has been beneficial. There's a lot of products that you can put on your skin. I'm going to get to that in a minute. And a lot of the products, like green tea, they can impregnate into creams to put on. I'm not in favor of them, and you'll understand why. I'd rather you take, green tea supplements because it can help. It's been shown to reduce sebum, acts as an antioxidant and anti-inflammatory. Berberine also, and excuse me, curcumin. Um, Very important in helping stop the inflammation and fighting these infections. I should have also mentioned when I mentioned vitamin D, vitamin A. There you got to be a little careful. So I say 5,000 to 10,000 IUs is more than enough each day because again, you're not going to absorb it all. Whereas with vitamin D, I can take 20, 30,000 IUs without any problem at all. You're never going to see a hypervitaminosis D reaction. Likely, don't go and drink a whole bottle, but you might with vitamin A. You got to be a little more careful. Vitamin B3, nicotinamide, has been shown to also reduce acne. Um, Vitamin E, basically you want to get the mixed tocopherols. Vitamin E is tocopherol, and you want to get the mixed tocopherols and take one or two capsules a day. They generally, come in the same kind of strength, so it shouldn't be a problem. It's pretty kind of standard these days. Selenium, very valuable to take as a supplement for this. Many people are deficient in selenium. You need micro amounts of it, and there are plenty of products out there that contain, like multivitamins, might have that in there. Generally, if you take a multivitamin, you only have to add on a few extra things. Herbs, like, well, we talked about green tea, turmeric, aloe vera, uh, neem, licorice root, uh, barberry, burdock. Um, all these things have had some beneficial effects. If you want to go into Chinese medicine, you're going to have to see a Chinese medical, a doctor of some kind, um, because they're going to look at this in a different way. They're going to look at lung and stomach heat and damp heat and blood heat and liver key stagnation and all sorts of unusual things. And they've been beneficial as well, but not easy to find somebody that's great at it. There's homeopathy that helps with this. Sulfur and heparsulfus and calibromatum and silica and natrum muriaticum. have been used for acne. Sometimes they just call it acne preparation. It may have a whole bunch of these things in just one homeopathy. Um, they may be helpful in getting rid of it. And others have been under, and that you can take, like resveratrol because it's antibacterial, quercetin, um, grapeseed extract, boswellia, a whole bunch of other supplements, pycnogenol, spirulina. All these have been shown beneficial in fighting acne. But most importantly, um, if you can't get rid of it easily, let's see, let me give you something else. Right now, you can go to PromoLife, tell them I sent you, they may give you a discount, PROMOLIFE.com, and you can get organic ozonated glycerin. All right. And what you would take, you wash your hands carefully, wash your face with gentle soaps that don't remove all the oils easily from your skin, but basically clean it. And then you gently rub in a little bit of the ozonated glycerin to where you have acne. And this can help fight the acne in a very powerful way. I would prefer that you do that. Um, then use the organic ozonated oils that I used to recommend, like the organic ozonated olive oil. If you're having a problem with the glycerin, you might want to try the organic ozonated olive oil for the skin. But you want to put on a very light coating and gently rub it into the areas where there's infection to help fight the infection from the outside in and not block up the pores easily. And that's where the OG, I think, is superior. It won't block the pores up, whereas the olive oil, if you use too much, could do that a little bit. Yet it does add oil to the skin if it's very dry, and that can be beneficial in its own right to stop your oil secreting glands from over secreting. So you can go to promolife.com or call them at 888 742 3404. Now, having said all that, remember Doctor's Biome Essential, um, intravenous ozone for those of you that have very severe acne. This other stuff is all going to be extra and beneficial, but it ain't going to get rid of serious acne problems. That's where intravenous ozone that we've been using for years becomes very valuable. And not all forms of ozone therapy are created equal. So if people say we do ozone therapy, they may not have a clue, okay, as to whether that method that they're going to use is beneficial for you or not for this problem. They make claims, but it may not be. If you have questions about this, you can call my office in Manhattan at 212 581 0101. That's 212 581 0101. Or email me at Ozone Doctor, OZONEDOCTOR. The doctor is all spelled out. Ozone Doctor at yahoo.com. Okay, and please subscribe to my channel. This is very helpful. It's free, and you may want to come back, tell your friends about it, and listen to some of our other podcasts that you might find beneficial. And make sure you know all the ones we've spoken about, because right now you may not have a disease or a condition, or a family member or friend may not have a disease or a condition that we've already discussed on some of the other shows. But in the future, you may want to refer them to it. Okay, everybody. Thank you so much. Stay safe, stay healthy, stay well, and thanks for listening to me. Bye now.